Let me ask you a simple question. Whose responsibility it is to optimize the well-being of the employees at the workplace? Do Well is a platform where we are trying to bring us together, have a dialogue about the possibilities, because we are all seeing it up and close. So thank you for being here.
So I would say primary outcome would be to create this platform where we can freely exchange ideas and then identify a few action items that we can implement together as partners. And this is not a short-term thing.
Many of the wellness threats are invisible to others, invisible to yourself. Therefore, proactively helping and also identifying any issues early on will be very important.
Why is workplace wellness critical for the employer? Well, 90% of those in the workplace will report sick, but the total productivity loss is over 30 billion Hong Kong dollars a year, or 1.3% of the GDP. 87% of Hong Kong employees have reported suffering from work stress. Prevention starts with awareness. We have to be aware of this, and I think today is a great start.
In general, when we take a look at the data, we're seeing anything from $3 to $11 in terms of an ROI for every dollar that organizations are spending on their people's health and well-being, and that's quite significant.
We recently introduced the 4 hours time off for our employees for every month.
We've been doing this on-site vaccinations. We encourage them to bring their families too, because we know even if our employee is vaccinated, if the families are not, it's equally dangerous. But we realize that once you make it convenient, people do go and do it.
The main 3 health problems that Hong Kong people face: sleeping quality, migraine, and then the chronic disease. But with all the things we've done with workplace wellness, we've actually had double-digit net increment employment.
So Pfizer, I would say our role right now is as a catalyst, as well as at some point as a key partner in building content and driving these awareness initiatives. And that will allow the employers to build meaningful engagement for their employees.
Today we can learn from the panelists and also from the doctors that we need to think about how to spend our workplace health and also prevention by equally including the preventive care.
Healthy employees are the base of a strong and long-running organization.
Not just a more engaging workforce, but also the employers get an increase in colleagues' productivity. And I think that's the immediate value that we can get